Welcome back to Curious Now from the Center for Medical Simulation. I'm Jenny Rudolph, an organizational behavior scholar interested in what makes us tick as we interact with other people, try to lead our teams. And this week, as in the last couple weeks, we're focusing on what helps us create psychological safety for ourselves, within our teams, and within our organizations. This week, we're going to pivot to the second part of setting the stage that Amy Edmondson talks about, and that is emphasizing the purpose of the work. Why the heck are we even doing what we're doing? And I'd like to give an example. So recently, my organization joined a new organization, and in that merging process, we've had to get acquainted with each other's policies and procedures about how things are done. And recently, I was arranging to travel to another part of the world for one of our courses that I teach. And I realized I wasn't exactly sure what our accounting process was if I was going to buy a very expensive airline ticket. And in a way, this could be seen as a rather menial and trivial task and already set in stone how our accounting policies work on things like this. And indeed, it may turn out they are. Set in stone. But I realized the dialogue around how are we going to handle this had an interesting and important purpose, which is it was an example of how does our new organization work as a blended organization. And it was an opportunity for me to share my assumptions and goals and learn about other people's assumptions and goals, which I didn't know. And so something that might have seemed like an annoyance and adding some extra steps to my everyday work actually has been really interesting and intriguing to me because I care about how do organizations blend. And I want to influence it in a positive way. That brings us to our readiness goal for this week, which is we want you to be ready to find meaning in an otherwise menial task. That is, what is the meaning for you? Why should something matter? What do you care about in an otherwise menial task? So why am I talking about finding meaning in everyday simple tasks or menial task? It's because there are so many of them and they can really drag us down in the course of the day. And if you can find that little gem or that little kernel of meaning in even one or two of them, they might be an interesting challenge. How am I going to solve this particular issue? Like for me, how do I use this moment around an accounting issue to help our organizations understand each other better? It can be a moment of engagement with something that you thought was just going to be a chore. And if not those things, at least these chore-like things might be a little bit more tolerable. Why does finding purpose play a role in psychological safety for our team? It's because I think when people understand the why for the team, or they understand the why for themselves, it makes taking the risks to speak up, the risk to try something new or a little different, be worthy of the effort. And so as we think about setting the stage, that's why we want to think about purpose. I was blown away sometime last year, maybe 2 years ago, when I went to watch Simon Sinek's YouTube video, which now has 69 million views, on finding your why. And since it had 69 million views, I was thinking this is going to be the most amazing video ever. And it's good. But it's not the best presentation ever. I think Simon Sinek did it on a small TEDx stage. He's since done it in many other contexts, written a book. It's really obviously taken off. And why has this YouTube video about why taken off so much? I think it's because most of us, most of the time, think about how we're going to do the task that's in front of us, or what is the task in front of us, but rarely, why are we doing it? And I think Simon Sinek tapped into this hunger that we have to find meaning in our everyday work. And so that's part of what we're doing as a team leader, is trying to tap into things that other people find meaningful, or I myself find meaningful, or to give us an inspirational goal. And I'd like to give some examples of that from the work of the Institute for Health Improvement, IHI, and their large initiative to understand the psychology of change at work. And one of the things they've discovered is that if you want to engage in some sort of organizational transformation, which many healthcare unit leaders do, even if it's a small thing like changing how we manage a certain part of our clinical management process, IHI has found that you have to tap into people's intrinsic motivation, which is, what do they do because they care personally about it? And what they found is that clinicians often care about the patient connection. They went into healthcare to take care of patients, and when they have moments where they can slow down enough to hear what the patient's saying, use their years of training to offer a therapy that reduces pain or increases function, they find that meaningful. The other thing that IHI found was that healthcare workers take a lot of joy and meaning in the camaraderie of working together on a good team. And there's an interesting research study that came out during COVID that found that when you can do some work during the day that you would later report as a bright spot, and that can be having done something meaningful, like taking care of a patient in a way that made you feel like you really made things better for them, or you had a really great connection with your team. For example, you were doing one of those resuscitations that I talked about, which can be extremely stressful, and yet you left feeling like the team did the very best it could for the patient and the patient survived. That sense of having each other's back and supporting each other to do each other's best work is another thing that taps into people's intrinsic motivation. A few years ago, I got really interested in the work of Dr. Michael Rose, then at McLeod Health, and he's been really interested in thinking about how do we do process improvement in the operating room. So when you hear a sentence like process improvement in the operating room, you don't necessarily think of intrinsic motivation or passion or meaning or the things that people care about the most. But what he found was, as he started working with his colleagues in the OR, and they developed a shared language of how do you remove pebbles from your shoe as you're trying to take care of the patient each day. Little things like it's hard to rotate the patient from lying on their back to prone because certain attributes of the OR table that ultimately could be changed by the team. And all of a sudden, this rather difficult maneuver became much easier. He found that his colleagues loved to find ways to reduce the small daily frustrations caused by like broken equipment or a improper sterilization technique. And these things often were done in dialogue and collaboration, small huddles. So he got a twofer there in terms of intrinsic motivation. One was fixing things that bothered them every day and the sense of pride they got from getting to work in an environment that they themselves had improved, and the collaboration and camaraderie of doing it together. So I want to talk about finding purpose in a apparently very difficult situation. Might not be a menial situation, but it's one that doesn't look like it's a lot of fun yet. So 2.5 years ago, my colleague Laura Rock and I, she's a critical care pulmonologist, were asked by a team at one of our local health systems to think about a challenge of nurses and residents, and primarily residents of color or women residents, not getting along when they were trying to manage a patient, and there was some slight disagreement about exactly what to do and how to care for the patient. And when we were initially brought in to the project, as we were talking with our colleagues, they referenced this as mistreatment, that the residents were feeling mistreated by the nurses, and the nurses were feeling mistreated by the residents. And as Laura and I tried to figure out how to tackle this, we realized that there were some significant underlying issues, possibly issues of structural racism, structural sexism. And we knew we sure as heck weren't going to be able to tackle those in a small scale project like the one we were. And so we were looking for the purpose of what were these colleagues trying to do at point of care when they were struggling with each other's point of view and getting into conflict. And what we realized, based on Laura's interviews, not surprisingly, is they just all really wanted to take care of their patients really well. And their treatment of each other was really getting in the way of that. And based on this, I thought to myself, what they really need to take care of the patients is to support each other, because they both care about the same thing, and they might even care about each other if it was done if they could interact in a way that allowed that care to shine through. And so Laura and I and the colleagues we worked with at the health system renamed the challenge that we wanted to focus on creating mutual support at point of care. And this isn't just like kumbaya, be nice to each other, hold each other's hands. This was, how do I support you in taking care of the patient? How do we collaborate in taking care of the patient? This worked at finding purpose really in two levels. So one was for myself and the team I was organizing to try to work on this, both our colleagues at the health system and Laura and I. It wasn't very inspiring to kind of try to reduce mistreatment, because it seemed like if we reduced mistreatment, what was that going to be, like a little more vanilla version of mistreatment? But when we transformed it to, we want these people to have each other's back, and we actually got that language through the interviews that Laura conducted, all of a sudden there was a lot of momentum and traction and meaning there. So I'd like to summarize the three levels of purpose that I've talked about so far today that I think we can look for as team leaders who are trying to set the stage to create psychological safety for our teams. So one is a personal purpose for me. What is the gem? What is the meaning? What is the thing that grabs me in this menial task for myself? And the reason we're emphasizing that is if you don't have a habit or an ability to tap into purpose and meaning for yourself, it's really hard to lead others there. If you can't see purpose and meaning for yourself, it's hard to take others with you. The second thing we talked about was IHI's approach to helping other people tap into their intrinsic motivation. So creating contexts in your team where you can find intrinsic motivation for others. And the example of helping colleagues have each other's back, something they really cared about, was an example of helping a team find that. And then the third level of purpose that we've hinted at is, I need to talk about the purpose. I need to use it in framing the work. The reason that we're doing this is X, Y, or Z. And why that's important for psychological safety is, if I don't know why I'm doing something, and if I don't care about why I'm doing something, why the heck should I tolerate the anxiety it's going to take me to speak up? Why the heck should I tolerate the anxiety that I need to tolerate in the service of learning or the service of growth? Why the heck should I take the risk to put out a new idea about how do our organizations blend together? Connecting to purpose allows people to connect to things that connect to their courage, their motivation, and their, what we call in organizational behavior speak, discretionary effort. And that's why purpose matters for all of this. So let's pivot to our workout of the week. Thinking about one small everyday task, see if you can find and state for yourself the why of an otherwise seemingly trivial task. So the workout of the week is see if you can figure out and state for yourself the why or the purpose of a seemingly trivial task. Thank you for spending time with me on Curious Now. Curious Now is produced at the Center for Medical Simulation by James Lipshaw, and James also edits our podcast. If you've liked some of the thoughts here about how to lead a team, you might also be interested in our personal leadership coaching service and/or our inaugural leadership intensive launching in August 2026.